I'll look at another hormonal disorder, and this is what is known as hyperparathyroidism. So, if you look at this, you try to define terminologies. Hyper simply means what? The level of something is too high than what is needed. Then you can see the parathyroid hormone. So, you simply know that what? The hormone that the parathyroid gland is producing is too much. So, to say, the parathyroid hormone. So, these are the parathyroid glands. I could see them, you know, on the thyroid gland. So it's just a disorder where the parathyroid glands they are secreting too much parathyroid hormone. I know that the parathyroid hormone controls how calcium is being metabolized in the body, so it disrupts calcium balance. So types we have the primary hyperparathyroidism, which is caused by an abnormality in the parathyroid glands themselves, often a benign adenoma. While we have the secondary one, is triggered by another condition like chronic kidney disease, vitamin D deficiency, and this is lowering what? The calcium, okay, and it's forcing the gland to overproduce parathyroid hormone. The tertiary hyperparathyroidism, which usually develops after a long-standing secondary hyperparathyroidism, okay. So this is when the glands they become permanently overactive even if calcium levels normalize. Okay, so these are some of the signs. The person is weak. There's a lot of bone pain, depression, acid reflux, hypertension. So let's look at it. Sometimes there's no symptoms at first, but as it goes on, the person becomes weak and you know general muscle weakness, body weakness, bone pain or fractures, kidney stones, digestive issues like nausea, constipation, abdominal pain, you know, also mood changes and depression, also difficulties in you concentrating. Okay, so the diagnosis through blood test, and the blood test will show that the parathyroid hormone levels are high and calcium levels are high too. Urine test to check for calcium excretion and also bone density scans. So now look at if your bones are becoming weak. Okay. So for primary hyperparathyroidism, you basically try to do the surgery to remove the gland that is overactive because the glands are too small. You can't say you want to remove the tumor and leave the gland. The secondary hyperparathyroidism, you correct what is actually causing it, and you do a lot of vitamin D supplementation, or you manage any kidney disease that is alongside it. So generally, stay hydrated, do a lot of exercise, and maintain a good balance of calcium in your body and also vitamin D.